These are the 10 most important laws and legislative changes that could reshape life for California seniors starting in 2026. If you're among the 6 million Californians over 65, these upcoming changes could directly impact your healthcare, housing, finances, and daily life. Now I need to level with you right from the start. As we're talking today in late 2024, the California legislature hasn't finalized all the laws that will take effect in 2026. That's because our state legislature typically works 1 to 2 years ahead, and the 2025 session is when they'll pass most 2026 laws. But here's what we know based on recent legislation, current proposals, and the clear direction California is heading. We can identify the key areas where major changes are coming. Think of this as your early warning system. By understanding what's likely coming down the pipeline, you can prepare now for the changes that will affect you and your family. Let's start with healthcare, because if there's one thing every senior worries about, it's medical costs and access to care. Number 1 on our list is the expected expansion of Medi-Cal benefits for seniors. California has been steadily expanding what Medi-Cal covers, and by 2026, we're likely to see comprehensive dental and vision coverage become permanent features. Right now, many of you are paying thousands out of pocket for dental work and new glasses. That could change dramatically. The push for prescription drug pricing reform is gaining serious momentum too. With the average California senior spending over $4,500 annually on prescription drugs, the legislature is under intense pressure to act. While we don't know the exact form it will take, expect to see new laws capping out-of-pocket costs for common medications, especially those for chronic conditions like diabetes and heart disease. Telehealth is another game-changer. The temporary authorizations from the pandemic era are likely to become permanent by 2026. This means you'll be able to see your doctor from your living room for many routine visits, saving you transportation hassles and time. For the 1 in 4 California seniors who live alone, this could be transformative. Now let's talk about housing, because keeping a roof over your head shouldn't require choosing between medication and mortgage payments. Number 2 involves property tax relief expansions. California's Proposition 60, 90, and 19 already provide some property tax protections for seniors, but advocacy groups are pushing hard for more comprehensive relief. By 2026, we could see expanded eligibility and higher benefit amounts, especially for seniors on fixed incomes. The third major change targets senior-specific affordable housing requirements. New developments may be required to set aside a certain percentage of units specifically for seniors, with rent controls tied to Social Security income levels. If you're struggling with California's sky-high rents, this could offer real relief. Eviction protections represent our fourth key area. Current proposals would make it much harder to evict seniors, especially those over 75 or with documented health conditions. The goal is preventing senior homelessness, which has been rising alarmingly across our state. Let's shift to something that affects many of you directly: protection from scams and elder abuse. Number 5 focuses on digital fraud protections. With financial exploitation of seniors reaching crisis levels, expect new laws requiring banks and financial institutions to flag suspicious transactions on senior accounts. Some proposals include mandatory cooling-off periods for large withdrawals and automatic family notifications for unusual activity. The sixth area involves strengthening penalties for elder abuse, both physical and financial. The legislature is considering making certain crimes against seniors automatic felonies with mandatory prison time. They're also expanding who's required to report suspected elder abuse, possibly including bank tellers, postal workers, and even hairstylists who regularly interact with seniors. Now, what about those of you who are caregivers or need care yourselves? Number 7 addresses the caregiver crisis. California is exploring caregiver tax credits, potentially worth thousands of dollars annually for family members who provide unpaid care. There's also serious discussion about extending paid family leave specifically for elder care, recognizing that caring for an aging parent is just as important as caring for a new baby. Home care worker wages represent our eighth major change. With a severe shortage of home care workers, the state is likely to mandate significant wage increases by 2026. While this might increase costs initially, it should also mean better quality care and more available caregivers when you need them. Here's something that might surprise you: transportation and mobility. Number 9 involves senior-specific transit programs. By 2026, we could see mandated senior discounts on all public transportation, not just some systems. There's also discussion about requiring ride-sharing companies to maintain a certain percentage of vehicles equipped for seniors with mobility devices. The autonomous vehicle revolution is coming faster than many realize, and California is working to ensure seniors aren't left behind. Proposed regulations would require self-driving car companies to design interfaces specifically for older users and provide training programs. Finally, number 10 addresses social isolation and community connection. The legislature is considering mandating funding for senior centers in every California community over a certain size. They're also exploring intergenerational program requirements for schools and senior facilities to work together. Why does this matter? Because social isolation literally kills. It's as dangerous as smoking, and California is taking it seriously. Beyond these 10 major areas, keep your eye on several other developing issues. Climate resilience is becoming a senior issue, with new requirements likely for cooling centers during heat waves and better emergency evacuation assistance for those with mobility challenges. Utility companies may face new restrictions on power shutoffs to homes with senior residents. The digital divide is another frontier. By 2026, we might see internet service treated as a utility for seniors, with affordability programs similar to Lifeline phone services. Digital literacy training could become a covered benefit under certain health plans. Workforce participation is getting attention too. If you're among the many seniors who want or need to keep working, expect stronger age discrimination protections and possibly tax incentives for companies that hire older workers. Skills training programs specifically for workers over 60 are also in discussion. End-of-life planning could become more accessible. Proposals include simplifying advance directives and making basic estate planning services available through senior centers. The state recognizes that too many seniors lack these essential documents, leading to family crises and unnecessary conservatorships. Now, you might be wondering, how will California pay for all this? That's the trillion-dollar question, and it's where much of the political fighting will happen in 2025. Some proposals include special taxes on high earners, others suggest redirecting funds from other programs. The Master Plan for Aging, which California pioneered in 2021, provides the blueprint, but funding remains the challenge. Here's what you need to understand about timing. The 2025 legislative session starts in January. That's when specific bills addressing these issues will be introduced. You'll have opportunities to make your voice heard through your representatives and at public hearings. September 2025 is the deadline for the governor to sign bills that would take effect in 2026. Most new laws kick in on January 1st, though some budget-related measures might start July 1st with the new fiscal year. So what should you do with this information? First, don't panic. Change often happens more slowly than we expect, and there will be transition periods for most new requirements. But do start preparing. If you've been putting off creating advance directives or exploring Medi-Cal eligibility, now's the time. If you're struggling with housing costs, connect with senior advocacy groups who can help you navigate current programs and prepare for new ones. Stay informed by following organizations like AARP California, Justice in Aging, and your local area agency on aging. These groups track legislation and provide alerts when important bills are moving through the legislature. They also organize advocacy efforts if you want to make your voice heard. Consider joining or forming a seniors group in your community. When changes come, you'll benefit from shared knowledge and mutual support. Plus, the social connections are good for your health. Most importantly, remember that these potential changes reflect a growing recognition of seniors' needs and contributions. California's 6 million seniors, projected to reach 8.6 million by 2030, represent a powerful voting bloc. Politicians are paying attention. The laws and programs we've discussed today aren't just bureaucratic changes. They represent California's attempt to ensure that aging in the Golden State remains possible for people of all income levels. They acknowledge that today's seniors face challenges previous generations didn't, from the digital divide to climate change to the erosion of traditional pensions. As we head into 2026, California stands at a crossroads. Will we become a state where seniors can age with dignity, security, and connection to their communities? Or will rising costs and changing demographics force more seniors into crisis? The laws we've discussed today will help determine that answer. Your job now is to stay engaged, stay informed, and make your voice heard. The decisions made in Sacramento over the next year will shape how you and millions of other California seniors live in the years to come. Don't let those decisions be made without you.